Before VCLS, I worked in MHRA, UK regulator. Now with 25 years, I think, that I've been in the industry all around.
So MHRA was still part of the EMA, so I had the opportunity to work on scopes on the European level as well. And since joining VCLS, I work globally.
I started working for the UK regulator, the MHRA. I worked there for 14 years as a regulator in licensing. I was particularly interested in infectious diseases, and I developed an interest in PK/PD.
Every client has its particular question or particular thing they want to solve, and it's always nice to be able to provide support. Because I've worked at the UK regulatory agency in the past, I understand what the regulators are looking for. So it's nice to be able to put the cap of the regulator on to help my clients.
So anything really, from the first in human study through all phases of development, through putting together the dossier, through assessing of the dossier and giving the marketing authorization, we have seen it and I have seen it.
So there are a lot of early interactions that they can pursue to get feedback on their overall development and understand whether they're on the right track, whether there's any improvements, whether there's any challenges that the regulatory agency can foresee, and if there's any hurdles that they could incorporate earlier on in their developments.
Because the regulator doesn't operate in a vacuum. They have a very clear legal framework within, and then you have a framework of references and guidelines. So it is quite often that's something that the client doesn't understand. So we all worked for 10 years or more as regulators ourselves. That's certainly an asset that we can bring to the company and to the clients.
I don't quite understand your strategy, or I do understand your strategy, but I don't know whether the regulatory agencies would like it. But I understand you, and I'm going to support you to get that outcome you want. So that for me will be successful.
They can see the problem from both sides. As a doctor, for example, that clinical experience, understanding all of the issues around that from the patient's perspective, that's really important as well as regulatory experts, and of course publishing, a really nice range of different skill sets within the team.
So if you have a company like VCLS that can accompany you all the way from start to finish, will be surprisingly useful for a company. And it is useful to remain engaged throughout the process with the company that supports you, because there's benefit in all sorts of areas along the way to be had.
It's rewarding to know that you start on a journey that was going to be very difficult, a journey that was really a rush, and then you get to completion, not just on time but ahead of schedule. That is beautiful.